Stem cell therapy is a regenerative medical approach that aims to repair or replace damaged tissues by using the body's own healing mechanisms, rather than just masking symptoms. How it works. Response to injury. When the body is injured, it sends out distress signals that stem cells detect. Migration and activation. Stem cells travel to the damaged area, where they integrate into the tissue. Regeneration. Once there, they differentiate into the needed cell types, e.g., cartilage or nerve cells. Stimulate healing through paracrine signaling, releasing molecules that encourage surrounding cells to repair themselves. Treatment process. 1. Harvesting stem cells. Collected from the patient, autologous, or a donor, allogeneic. Common sources, bone marrow, fat tissue, or umbilical cord blood. 2. Processing. Stem cells are purified, concentrated, and sometimes multiplied in a lab. 3. Administration. Delivered via injection, infusion, or during surgery. Usually outpatient and minimally invasive. Outcome. Patients often see improved function and reduced pain over time, making stem cell therapy a promising option for various conditions. Stem cells are powerful, natural healers. And this is just the beginning.